Hello and welcome to another video on my channel. My name is Gottfried and the topic of this channel is Cranio Cervical Instability. Today I have another special guest from the United States, Dr. Carolin McMakin. She is Doctor of Chiropractic, and the topic what we're going to discuss today is a very unique one because I have not seen it being touched on the international CCI channels so far. It's can frequencies heal ligament damage? And yeah, that's a very, very special hot topic. And I'm very curious about the session today. Hello, Carolin.
Hello, it's nice to be here. Thank you for having me.
Yeah, I will briefly explain how we came together. I recently had an interview with a doctor from Switzerland. It's Dr. Januszas, who's offering stem cell therapy in the craniocervical area here in Europe. And he said, Uli, this frequency thing is a very hot one. You need to pursue it. So this was the reason why I got in touch with you, and I'm very happy that you, accepted the interview request.
Oh, my pleasure. It has taken us 30 years to become the hot one. So I'm happy to spread the word about what is possible with frequency-specific microcurrent.
Right. I mean, you're very much into this topic. You also wrote a book about the resonance effect, and you hosting, I think it's a company, FSM, right? It's
Right?
a shortcut for frequency specific microcurrent.
Yes.
This sounds curious.
I will explain.
So what is it about?
Well, in 1995, I worked with someone who had a list of frequencies. Well, actually, I worked with someone, and he said, I have a list of frequencies that I got from an osteopath who bought a practice in 1946. He walked into that practice, and in the back room was a machine that was covered up with a sheet. He took the sheet off, and there was a machine that was built in 1922, and that machine had a list of frequencies. Now, starting in 1908 up through about 1935, there were thousands, 7,000, 8,000 physicians in the US, the UK, Germany, Australia, using frequency-specific therapies with a kind of device that plugged in the wall. The American Medical Association decided that the only therapies to be allowed would be drugs and surgery and radiation, and that herbs, homeopathy, and frequency therapies would all be outlawed. So by 1935, any practitioner that used frequency therapies would be prosecuted and put in jail. So naturally, everybody stopped using the devices and the frequencies, except for a few. And so the osteopath who moved from England bought this practice, and instead of throwing the machine away, the doctor had put it in the back room and covered it up with a sheet. Well, this osteopath didn't know anything about the FDA in the United States, and he started using the frequencies in 1946. My friend went to work with him in 1981 and brought the frequencies back written on pieces of paper and stuck them in a drawer. In 1995, we had a 2-channel microcurrent machine that was FDA approved, and we had the list of frequencies. And my colleague said, I wonder if those frequencies would work with the microcurrent machine. So we started using the frequencies with the microcurrent machine. And it takes two channels, one for a condition, one for the tissue. And that's the way they were arranged in 1922. And long story short, the frequencies did exactly, but only what they were described as doing. So the frequency to reduce inflammation only reduces inflammation. But according to the data we have from animal research in Sydney and human research conducted with the National Institutes of Health, we found out that the frequency to reduce inflammation reduces inflammation about 5 to 10 times better than any drug ever developed, prescription or non-prescription. And then the other frequencies appear to do exactly what they are described as doing. So that's, and we started using them in 1995 and 96. I started teaching them in 1997 to find out if they were reproducible. Were they actually working, or did they work because the walls in my clinic was pink and I was somehow magic? So was it all placebo? And it turned out that it was teachable, reproducible, and actually at this point has a fairly well-established mechanism of action that makes sense. So that's the story. And there's a lot of stories. If you read The Resonance Effect, it's in German, French, English, Mandarin, Polish, and soon to be Italian and Spanish.
Oh, okay. So it's a hot topic then.
Yeah.
Carolin, my question would be, how exactly does it work? I mean, is the device producing current, or is it taking the energy or frequencies from the body and reflecting it in a different frequency? That would be of my interest. And another thing is, like, your microphone is scratching a little bit on your clothes, I think. So it's a little bit.
Is that better?
Yeah,
Okay.
if you hold it a little bit, that would be better. Yeah.
Thank you. We have had the technical issues this morning.
No, it's fine.
So the frequencies came from the list. So how they developed them is lost. They started working on them in 1908, and by 1922, the list was well established. So I took the list. That was the first thing. What else? Oh, the device is a microcurrent device. It is battery operated. And so it takes electrons from the batteries and it's direct current. And then, so direct current is just sends electrons from here to there.
Yeah.
But when you put those electrons through a bunch of circuitry, it changes it into pulses. And what we found out over time was that it has to be a square wave. So square waves have a lot of high frequency harmonics that make a square wave. Sine waves, which are absolutely precise. So if you put in 40 hertz on a sine wave, it is 40.000. If you put in the frequency for the liver, it's 35.000. Well, the problem is with a sine wave, they don't work. And that's because my liver may be 35.416 and your liver may be 35.172. So you need a little bit of, I had a physicist describe the process to me as fuzz. You need a little bit of fuzz around the precise frequency. It can't be precise. It has to be a square wave with some variation that makes it a square wave. And that way, my liver and your liver, the basic frequency, 35, is correct. But there's a little bit of variation to account for the difference between my liver and your liver. And the devices that say they take a frequency from your body and turn it around and make it a treatment, after 30 years of doing this, I have to tell you, I don't believe that's possible, because I don't trust machines. I trust people. I trust my goal with frequency-specific microcurrent was to make it as acceptable and useful to medically trained, scientifically based clinicians. So a third of our practitioners are MDs. I wanted it to be in the medical community, which means that you have to use their mind. So when you look at it from a physics perspective, it really is not possible for a device to read the condition of your liver from a galvanic skin response. All any machine can do is read the current that comes off your fingers or head or whatever it attaches to. Okay, that, if you think about it, there really is no way it can tell the condition of your liver from the current that comes off your hand. So that's a whole nother conversation, and not a lot of people are happy about it, but that's my position. The other thing is, we have data that says that, from 3 different papers, that the current by itself, without the frequency, just the current, will increase ATP or cellular energy by 500%, by 5 times. It increases protein synthesis. It increases cellular communication. And it increases ATP production by 5 times. Then when you add the frequencies, if you put all of the data together, what appears to be the mechanism, so you have to have a mechanism that makes sense, is that the frequencies affect cell membrane receptors. So the outside of the cell is full, covered completely with, they're like little antenna dishes, protein receptors.
Yes.
All right, so let's say they look like this. And something comes along like a virus or a toxin or a bit of torn tissue, and those receptors react to that chemical or that bit of tissue by changing their configuration, and they are connected to the inside of the cell. So that changes kinases, that changes the DNA, that changes the microRNA, and that changes what the cell does. That's like a key in a lock. Something lands here. All right. The frequencies, because you asked how do they work? The frequencies act like your key fob that opens your car door with a frequency-specific signal. You have 10 cars in a row that look just like yours, but you have a key fob that only has a frequency that connects to your car. Well, the frequencies from the list only connect to this receptor, and it only connects when, let's say, you want to repair a tissue or reduce inflammation. And so you can do it with a key, like a drug, like ibuprofen to reduce inflammation, or you can do with the key fob, and reduce inflammation that way. And it changes what the cell does. So it matches all of the data that we have, and it's a reasonable model. It's not esoteric, it's physics. So that is my position.
Actually, I also do have very good experiences with frequencies. So that was also the direction of my question. I also read some books about it, and I was in treatment also for a couple of years. Unfortunately, not with your device, but
that's okay.
Many therapists here in Europe use devices from Bicom, or Ryonix, which is, I'm not quite sure whether it's the same mechanism. It's also about frequencies, and how I understood is that if, for example, the liver or a ligament is not working right, every cell has a special frequency. If it's harmed, it might be too fast or too slow.
Sure.
Let's say we have a cell which is too slow in the frequency.
Not correct.
The device would give a kind of push, to bring back the cell into the right frequency. Is this kind of explanation also true for your device?
I don't know that it's, how would I put this? I don't know that it's true or not true, because every model that you have for how the frequencies work is just model. We have no proof that any idea about how they work is actually how they work. We have no, there's no proof. So if that's their idea about how they work, it's not the same as my idea.
Okay.
But there's no reason theirs can't be true for the way they think about it. I have data that says mine is probably correct. If they have data that says, for someone that is in the alternative realm, I am very data driven. So we had 10 years, almost 15 years trying to come up with a model that matched the data. And it wasn't until I saw the inner workings of a cell that this model of a cell receptor and the frequency affecting the cell receptor the way a key fob affects a lock. So you do it with a chemical or a nutrient. You take vitamin C in, it's like a key in a lock. And it goes into the cell and it makes you not have scurvy because the cell reacts a certain way. All right, I don't have a frequency for vitamin C, but you have Advil, a drug, an anti-inflammatory. It lands on this receptor and it stops the cell from producing inflammation. Well, the key fob, the frequency, does exactly the same thing. And we only came up with that model after the data said that we could. Then we had to explain how we did it. So I don't have an opinion about the other two devices you mentioned because I don't know anything about them.
It's okay, but I mean, I was very much convinced about. You thought that the measuring thing is, you think it's not possible, but on my body, and I do not believe it, or it's nothing. I had the feeling the measuring is right, because when it indicated the liver is not in the right frequency, it was like this. And when we treated the liver, it improved. Anyway,
I had someone who had a device from Russia, and there's a frequency. It had just things on my fingers, and on the screen appears my pancreas. And we knew that my pancreas, I knew, he didn't. And so there, the device identified my pancreas. So something about it works. So.
So let's talk a little bit about the ligaments.
Okay.
So you said in the I get some visitor here.
Yes, I see.
That you also treat people with instability in the upper neck.
Yes.
and you have also improvements there. Can you tell us a little bit about this? Because it's a very new approach for instability to treat ligaments with frequencies.
Yeah. And it isn't the frequencies by themselves. What we found was almost an accident. So we're treating the cervical spine, and we found out that in order to get the muscles to relax, you had to treat the underlying pathology that made the muscles tight. So we would treat the neck, and the suboccipitals were still like a rock. And then I looked at the suboccipitals, and in order to be able to feel them, you had to get the upper trapezius out of the way. Well, the frequency to quiet the accessory nerve made that muscle just disappear, made it soft so you could feel what was under it. And then the next layer of muscle is innervated by dermatomal nerves. So we quieted those nerves, and those muscles went away. And then you could feel the suboccipitals. Why were the lateral suboccipitals so tight? Well, it was, you look at them and you look at the alar ligaments, and I just guessed. I ran the frequency for torn and broken in the ligaments, and the lateral suboccipitals, the obliquus capitis superior, inferior, on the RCP major just relaxed. Now, if they're totally tight, they're spastic in order to hold C1 stable, but they're also weak. They don't contract. They're weak.
They are contracted, right, to almost the maximum. So there is no more room for even more contracting. So that makes them weak.
Yeah. And a muscle gets strong by relax, contract, relax, contract.
Right.
And you can't go from contract to contract. So we treated torn and broken in the ligaments. And back when I had a very busy practice, we've had a patient with 4 millimeters of translation of C1 to the right and 3 millimeters to the left. So C1 had 7 millimeters of translation, which is dangerous. And it was from trauma. So we treated torn and broken in the ligaments, got the muscles to relax, and then did exercises, very small, to just get the muscles to contract and not challenge the ligaments. So basically, the patient started exercising while she was laying down. She didn't get up. And we taped C1 to keep it central. We treated the ligaments, exercised the muscles, and in 3 months, there was 1 centimeter to the right, 1 centimeter to the left. It was done. So I haven't done it a lot, but operating on the alar ligaments and fusing it is so dangerous that you really can't find anybody in Portland to do it. So we have a pretty good success rate, but it takes months to carefully strengthen the muscles to take the place of the ligaments and treat the ligaments so they are less lax, less loose. Yeah, and you can also treat the headaches because the headaches come from the joints at C1, C2, and C3, and from the tight muscles. So you do all three. Patient cares about the pain. You get rid of the pain, they're fine.
So if I repeat it in my words, and I'm not quite sure whether I got it exactly, but you treated first muscles here in this area, right?
So
and
you
that was
could
mechanical. You treated this by massage or by trigger point release, or not, but not with the frequencies.
You treated
with the frequencies.
Just with the frequencies. So you just are feeling, and you have in the way, in between you and the upper suboccipitals, there's this brick that's in the way, and that's the upper trapezius. We'll use the frequency to relax the accessory nerve, and that makes the upper trapezius just melt and get out of your way.
Okay,
And
I need to ask again. So you touch and feel that it's tight, and then you adjust the frequency of your device and treat it.
Yes. Yeah. And so you have to know that, I mean, we release a recipe and you treat in a certain order. I'll show you a picture in a minute.
Sure. But again, that's important for me. You feel it's hard, you treat it by the frequencies, and then you feel again, and you feel it. You feel a difference.
Oh,
Immediately.
In 2 seconds, it starts to soften. It may take as many as 2 minutes, but yeah, then it just turns to pudding.
Okay.
Yeah, it's hard to believe until you feel it.
Yeah. And you said you had also experiences with stainless patients, where the ligaments overall are from the consistency too soft or genetically, yeah. And this is tightening the ligaments of the total body.
All of the connective tissue. So according to this, we have 4 seconds left, and then it's going to stop. No. All right. So we connect the patient at the neck and at the feet. And in Ehlers-Danlos, the finger goes up to 90 to 100 degrees.
Yeah.
The thumb goes to the wrist. The elbow goes backwards. Right. They have 9 out of 9 Baton points. And then you connect them from the neck to the feet, and you run the frequency for torn and broken in the connective tissue, because it's not ligaments, it's the connective tissue. And then you also run a frequency to quiet inflammation in the spinal cord. That's what gives them the body pain. And then you run 3 devices. Then you run a frequency for improving the vagus nerve. And at the end of 60 minutes, their range of motion is completely normal. The finger only goes to 70 degrees. The thumb stops here. The elbow is at 0. And they're not hypermobile anymore. And it lasts.
How long does it keep? It's not forever.
1 week. I can understand 24 hours. I still don't understand how you take a genetic condition, change it in 60 minutes, and it lasts 1 week. And I have one patient, I treated her 1.5 years ago, 2 times, and it's done. She's never gone back to being hypermobile. I don't understand that, but it lasts 1 week. And then
I have talked to some hypermobile patients, and they said maybe the gene was different from my childhood, but there is one incident who is starting to make it worse. Yeah.
Yes.
And so that means that it's not returnable. So I do see the possibility that your device is resetting the system.
Yeah, and I don't understand why it lasts a week, but what you say is true. There you can almost always identify a hypermobile patient by the accidents that they've had and the injuries they've had. So they are hypermobile since birth, just nobody recognizes it. Then something happens when they're 18 or 20, and then they get in pain, and then it's a problem. But we've never had it not work, and we're talking now hundreds of patients, and it never doesn't work. It's amazing.
The exercises that you do, is it how can you give an example how this looks like? Like you lay down and then you nod, or you do exercise, because there are also some exercises between the eyes and the deep neck muscles, some training devices with lasers where you have to look on the wall and do exercises, or you do exercises with the eyes, top left, top right, and so on. Is it the connection between the eyes and the neck muscles, or is it really training the neck muscle itself?
There when someone is very hypermobile, the neck muscles are so weak that if you put your hand on the back of your neck right now and you close your eyes and move your eyes, you will feel just the suboccipital. So put your fingers back there and you will feel just the suboccipital muscles move. You move your eyes to the right, back to center, move them to the left, you'll feel the suboccipital muscles contract. So in the beginning, in CCI patients, it is not safe to do anything more. They are treated laying down, and that's the first exercise, just to get the muscles to contract safely with the neck in neutral. Then, laying down, you tip the head back 5 degrees, turn it to the right 5 degrees, left, and it's little teeny motions because the whole muscle is only maybe a centimeter and a half. It's very small. So little teeny movements. Then when the muscles are strong enough, you sit the patient up and you put a baseball cap on them. And you put 1 ounce of rice between the cap and the brim. And the exercise is this. It's 5 degrees. Tip the chin,
Yeah.
just that. And it's an eccentric contraction of those muscles. Then you turn the head 5 degrees. And the trick is these muscles are only firing in the first 15 degrees of motion. So you turn, you tip, you extend. So eccentric contraction, concentric contraction, back to center, turn to the left. And this is after 2 weeks. So they have a ball cap, they have 1 ounce of rice. You do that for 1 week, 3 times a day, and they're getting treated. And then the next week, you take the rice and you move it out on the brim, so it's heavier, and you make the muscles work harder. And this is why it takes up to 3 to 6 months, because strengthening the muscles and then any injury or trauma, something minor, you start all over again because you re-injured the ligaments and the muscles weren't strong enough to hold it. So it's not easy, but on the other hand, it's not dangerous. So you use a combination of the frequencies to keep the repair the ligaments, and then you all have the patient go to their medical doctor and get a certain topical medication that keeps the joints pain-free and keeps the inflammation down in the joints, because the inflammation in the joints will also make the muscles tight. That's what hurts, is the joints. The alar ligament by itself is not a pain generator. It's the joints that now get moved too much.
Yeah, distracted.
They just get they get damaged because the ligament isn't holding the joint in place. Then you have arteries that go through at the occiput C1, C2, C3. And when C1 slides sideways, it changes the circulation to the brain. So you treat the vagus nerve every day, and it increases circulation to the brain and increases nitric oxide. So it's complicated, but on the other hand, there's no danger. And it's really pretty effective. The challenge is that by the time patients get to us, they have been told that they're hopeless. They have had treatments that don't work. They have treatments that make it worse. And so part of the challenge is just getting them to recognize that it's going to take time, it's not going to hurt, and this is how you use it. So does that make sense?
It makes sense. I also did the work on my believing attitude, or because subconscious in my subconscious, yeah, that the thought on being healthy was stressful for my body.
Yeah.
So I was like in a downwards path, like
Yeah.
and you also need to correct this, because this is, yeah, if you don't believe to get good
That
again,
it's possible.
it's yeah, you
Yeah.
need to improve it. You need to really believe it.
Believe it's
And
possible. But
yeah,
I think the doctor has to earn it. So I just tell patients, there's no reason you should believe me. But at the end of 1 hour, if you don't feel better, give me 3 days.
mm,
So you get them back. They come in with a headache and
mm,
neck pain
mm,
and brain fog, and they leave 60 minutes later. Their pain is down, the brain fog's better. By the end of the 3rd day, they become to expect that it's going to be better, and they begin to have hope at the end. And every time you explain to them the process and why it's going to take 3 months. Okay. You've been at this for 10 years. You've been in pain for 10 years. Give me 3 months. Okay.
yeah, yeah. So what is the frequency of the treatments? So you do one treatment every week or every second week, or how is
Oh,
this?
no. Because it's so difficult, 3 times a week.
Uh-huh.
And for many of them, it's they get a home unit. It's less expensive. They don't need me to treat them. So I will send them home. They purchase a unit and they treat themselves at home, save money by not seeing me. Then they can see me once a week. They go to the physical therapist. I'll have them spend money on the physical therapist, or I'll have them do their exercises at home and see them once a week to check in, use the medication on their neck, and then once a week, and just keep track. Uh, whatever suits the patient's preference and their budget.
So I
Yeah.
think you have prepared some pictures from the device and from the treatment. I think it would be the
Yeah.
right time to have a look how this treatment would look like.
Let's see. So, neck and shoulder, where's the, come on. All right, I opened up the one, there it is. So, can you see this one? You see the slide?
Not yet.
Uh-oh. Well, let's see. I don't know.
Share on the top right.
Okay. Share content. Let's see. Presenter mode. Screen. Okay, there we go.
Yeah, it works.
There
it works.
Okay.
Now I see the slide with the, yeah.
So we have, this is the practicum where I teach people how to do it. And you can see there's the alar ligament and the transverse ligament holding C1 as a ring. And it's held stable by these 3 muscles, right?
Right.
And to get these 3 muscles to relax, you treat our frequencies for torn and broken and the ligaments. And the practitioner, the picture's not right, but the practitioner will have their hands underneath the patient's neck at the base of the skull. And you run quiet the upper trapezius to get the muscle out of the way. And that allows you to feel for these tight muscles. Then there's the RCP minor, rectus capitis posterior minor, and it is connected directly to the dura by a strip of connective tissue.
Okay, that's new for
And,
me.
pardon?
That's new for me, that the muscle is connected to the dura.
Yeah, it was to me too. But once somebody told me about it and I got a picture of it, it's like, it made complete sense.
Uh-huh.
So in order to release the RCP minor, it's going to be a brick, like totally tight right in the middle, because when you whip your head back in an injury, you get a little bit of a bleed and you get scar tissue between this muscle and the dura. So the cerebellum will keep this muscle tight in order to protect the dura. The same way the cerebellum keeps these muscles tight in order to protect C1, the alar ligaments, and the vertebral and carotid arteries. So you treat the ligament, these muscles relax. You treat scarring in the dura, this muscle relaxes. So now the suboccipitals are relaxed, but then you go down to the muscles over the facet joints, and then we treat the tissues that make up the posterior joints in the spine, treat them for inflammation, hardening, scarring in the nerve. So there is the medial branch of the dorsal root. You treat scarring in the nerve to release the nerve from the edge of the joints capsule. And these upper joints are tight and tipped back because the lower discs are injured. So you treat the disc for being injured and inflamed, and then you find that all of the muscles in the neck relax. Then just to prove to students that it's working, you have them treat the muscle, and 99% of the time they find out that treating the muscle doesn't do anything. Then they increase secretions, that's what 81 hertz does, in the fascia to support the muscles, strengthen the fascia, strengthen the connective tissue, and that's it. And that's how you treat the supine cervical. So if you're treating a patient with CCI, you treat the whole neck because the whole neck will be dysfunctional, but you focus on the upper cervicals, and you have one machine who is only running torn and broken in the ligaments for 60 minutes while the patient is exercising these muscles. So the important thing is to teach these muscles to take over the job of the injured ligaments. Does that make sense?
It's kind of hard for me because, I mean, the ligament itself is or was injured, and the body contracted the short neck muscles in order to protect the structures. Now it's difficult to tell the body relax this muscle, because then you can,
Strengthen. You can
strengthen them. But I
And
mean, but in this case, the body would have reacted wrong, right? Because it
no,
would tightening the muscles.
well, it is tightening the muscles because the ligament is torn. When we run the frequency to repair torn and broken in the ligament, what we find clinically, I only do this because it works. What we find clinically is that the muscles relax. The only
Because
reason
they have the confidence that the ligament is doing its job again.
Mm-hmm.
It's like,
Yep.
okay.
It's signaling.
Yeah.
So the ligament stops signaling the brain that it is injured and needs help to protect this, basically the brainstem. And these muscles start to relax. And while the muscles are relaxed, you get them to relax and contract, relax and contract. You begin to strengthen them while you're treating the ligaments. And it is a long process, but I've been doing it since 1998, 99, with physical therapists here in Portland who specialize in small movements with small muscles. They're the ones that taught me, if I repair the ligaments, they can strengthen the muscles. And then I started doing it myself because I was a patient. I keep falling off of horses and injuring my neck and various body parts. And so they treated my neck, and it's like, oh, you just do that. Okay. Well, this is after I'd sent them 20 patients. And it's quite a amazing process when you find out that it actually works. And what's interesting is the number when we teach a class of 40 people, and we have or 30 people, we have 10 tables with 3 people apiece. We do this practicum, this slide here, 3 times. And these people do not have cranio cervical instability. They have normal tight neck, old auto accident, old injury, minor, medium, inconvenient, right? And every single person in the class feels better after they have their neck treated. It's quite extraordinary. The number of people that have this and don't know it. Right. CCI patients have this and do know it.
Right.
But they also almost always have Ehlers-Danlos or hypermobility in general, where none of the connective tissue, the joint capsules, the ligaments, the connective tissue, none of it works correctly. And I teach activating the suboccipital muscles. Just move your eyes. Then concentric contraction, eccentric contractions, right? We have one protocol when you treat a patient with Ehlers-Danlos and you treat the neck. If you do just the suboccipitals, they don't respond. The only thing you treat in an Ehlers-Danlos patient is torn and broken in the ligaments, torn and broken in the connective tissue, and torn and broken in the dura. And so you treat an Ehlers-Danlos patient's neck differently than you treat a standard patient. So it's very specific. I guess that's why we call it frequency specific.
Sure. Of course, also tendons have a frequency, because I had also a very interesting talk with Brian Hutchison, also from the United States, from Florida, and he is also having success in doing dry needling to tendons in the shoulder area, and has also improvement to the instability. So I mean, your device could also be attached, could also be set to the frequency of tendons, right? To
Yep.
ligaments, to any tissue in the body, very specific, also to organs like liver, kidney, or connective tissue, so you can treat
Connective
everything.
tissue.
I mean, we were much focusing right now on the neck, but basically, and this is also on your website, you can treat all pain conditions, so also for the knee, for example.
Yeah. So when you treat Ehlers-Danlos, you treat connective tissue because their connective tissue is made wrong.
Right.
And so you want to, the way dry needling works is it injures the tissue and causes scar tissue. The way our protocol works is it just changes the genes in the tissue and makes it normal for 1 week.
Sure.
And
I think you also have a picture from how you treat the patient, how this device is on the body of a patient.
yeah, and it's, so I have, because of the FDA, I have to do this in 2 separate practicums. So this is how you treat the patient. You notice there is no picture of a device, right?
Okay.
So when you treat the neck and shoulder, you treat adhesions in the nerve, you treat the joint capsule, you treat the mechanics. And so that's how you, right? So I can have pictures of the connection to the patient, but according to the FDA, you have to have a separate picture and a separate program for the devices.
Okay.
So I can't show a picture of the device in any slide presentation that shows treatment.
Okay.
Right? It's
Okay.
FDA regulations, but
But that also means that in the United States, the treatment with your device, is this covered by the insurance?
Yeah, because the devices are approved in the category as if they are TENS devices.
Okay.
So it is in use at Cleveland Clinic, at Shirley Ryan Rehab Hospital, at Cincinnati Children's Hospital, at Mercy St. John's Hospital, at Mayo Clinic is looking into it. Walter Reed has been using it for 15 years. MDs, PTs, OTs, chiropractors, acupuncturists, every clinical degree that is allowed to use electrical stim and treat patients.
Okay.
So the device is approved as if it is a TENS device, even though it delivers 1,000 times less current than a TENS device. But it is approved as if it is a TENS device. So you have to, so when I treat Ehlers-Danlos, I have to have, if I'm going to bill or charge for the use of the device, I have to have a diagnosis that includes pain, right? Because the device is approved for the treatment of pain. Yeah. So the diagnosis for the device. So this is a device that is manual. It allows you to set each frequency and the current and the waveform and the polarity according to what you feel with your fingers. So this is for manual therapists or MDs that like treating precisely. You feel the abdomen, you know what you're feeling, you treat a condition, you know what you're treating, and you want to choose specifically. Some things like the vagus nerve, like liver support, like small intestine support, like ovarian cysts, those can be automated. So the custom care is programmable on a computer. And when a patient does home treatment, you program this unit for the patient, and you send the patient home with a custom care, let's say an Ehlers-Danlos patient, he has to treat himself once a week. Well, there's no reason he should spend $300 and come and see me for once a week. He can treat himself at home. This is easy. So he hooks himself up. He can use a magnetic converter. It converts frequency-specific electrical pulses into frequency-specific magnetic pulses, and he can treat himself at home. So these are the 3 devices we sell. There are other, I don't sell any. I have to have a separate company. My husband owned that. Now my banker owns it. And it has to be separate because I make statements about what the frequencies do that cannot be made for the device. That device, according to the FDA, only manages or treats pain. Mm-hmm. The device does not reduce inflammation. The device does not repair connective tissue. The device only reduces pain. I can say anything I want about frequencies because I'm a researcher. I am sharing the results of my research with other clinicians, and that is protected in the United States by the First Amendment. So I'm just sharing information about the effects of the frequencies to encourage other people to pursue this research and attempt to duplicate my findings. Mm-hmm. But the device is regulated. The frequencies are not. And so I tread a fine line in the United States.
So
and Germany.
Yeah, the question now is like, if I would like to try it, right?
Yeah.
How do I find the therapist in the United States, and is also a treatment in Europe, Germany, Switzerland, Austria possible?
Yeah, I've been training people in Germany, Switzerland, Austria, the Netherlands since 2015, so almost 10 years. I work with TimeWaver, developed, they have a device that does diagnosis, but they also became intrigued with my work and came over in 2014 or 15, took my class and developed frequency. They had TimeWaver frequency, which delivered frequencies, and they developed TimeWaver McMakin that runs where you can choose specific protocols and it doesn't do any diagnostics. I want the diagnostics to be done in here. I want your fingers and your brain to tell you what frequencies to use, what is wrong with the tissue, what to do with it. You have the patient history, you have a physical exam, you have your fingers, you have your professional training. I want you to decide. I don't trust machines to make diagnosis, right?
But do you have a list of therapists?
Yes. Do we have the European therapists on our website?
I share the website briefly. I share the website.
Yeah, you go to frequency.
This one here, right? I'm here at frequency-specific.com.
Yeah, frequency
find a practitioner, right? Find a practitioner.
Find a practitioner. And
zip code.
Click on the
this
country
is in the US,
advanced.
Huh?
View advanced search options. So then you sit this little box over here. Advanced search options.
Yeah.
Then that says the country. So Canada, we've got Germany, and then searching.
Yeah, works. Yeah, perfect.
Yeah.
Good.
It took us quite a while to get that implemented. We have quite a few practitioners in Germany.
Yeah.
One MD in the Netherlands. He's brilliant. We have one MD in Egypt, quite a few in Hong Kong. Netherlands will be, what's his name?
Van der Bolt. Johanna van der Bolt. Yeah, sounds. It's a
Diana
female.
Vanderbilt. Yeah, and there's an anesthesiologist. What is his name? Maybe he's not in the Netherlands. He's up there someplace. We have one or
I
two.
checked Switzerland as
Switzerland,
again.
yeah. And there is somebody in Switzerland.
Yeah, it's good. Yeah, one person.
Yeah.
It's like
one person.
Martin Jenser. Yeah, very nice. Okay. Yeah, I didn't find that before because I had a look on the webpage before. So now I think it's
clear. You have to go to advanced search options. So maybe we should call that a different name, like search for countries outside the US or something, to give you an idea that you have to click that. But I've been teaching seminars in Kuwait, Taiwan, Germany, England, Ireland, Australia, since Australia started in 2001. Kuwait was 2016. Germany was 2015. London, the first one was, I think, 2016.
Mm-hmm.
Ireland was 2005. I've just been around. All you have to do is last.
So, and once you approach this practitioner, the approach would be similar. You would do some analysis of the body, the condition, and then do first treatment there. Yep. Is there also the possibility to buy the device and then get the frequencies where you do a home treatment? Yes. And what are the costs?
In US dollars, sure. Our devices are made in the US. They have all of the ISO certifications, and they have the highest quality level that it's possible to get an electrical device. So US dollars, it's about $2,000 to $2,500 for the little one, and that's the one that people need for home use. What frequencies the practitioner uses on you will depend on how recently he took or watched a seminar, because I have learned so much in the last 5 years that the seminar is quite different now than it was 10 years ago. So if the last time they took a seminar was 2003, that was 20 years ago, 21 years ago. It's quite different now than it was then. I think about it.
The device itself is not very much different.
No, the device is not much different.
I mean, frequency is not the same.
Yes, frequencies are the same. How they think about it might be different, but they can look it up. The pre-programmed device comes with a mode bank that has preset frequencies in it, and the practitioner programs those on your device and sends you home, and then sees you the next week or 2 weeks or a month later to make sure everything's okay. And the new software allows us, let's say you're in Switzerland and your practitioner is in Germany and you don't want to get on the train or a plane. Well, the practitioner gives you a programming cable, and if you have a PC, you hook your device to the PC. The practitioner modifies your program, and emails it to you, and you download it onto your device. So that is our software. And the practitioner can add, let's say you only want to treat yourself at night. You don't want to do all this during the daytime. You get a magnetic converter, which is around $2,000 US. And you put the little magnetic head at your neck, and you put the other one on your abdomen, or both of them on your abdomen, and you run your custom care and you go to sleep, and it treats you for 6 hours. So you have many options. The big manual device is really for manual therapists or for practitioners that see very complicated patients, where they have to look at the list and decide what to use. So,
Okay.
yeah.
But the normal device would be the device, and then you have some kind of diodes or some kind of...
Basically, it's water. It's wet contacts during the daytime.
Some kind of towel or... No?
Yeah, we use a fabric strip with Velcro on it to wrap around your neck, and another strip to put on your abdomen, and you just hook the clips to that. Or you can use the magnetic converter if the patient really hates anything wet and they're going to be treating themselves at night.
Yeah, right, with the magnetic.
Yeah.
Okay. And the other one is like duration would be 1 hour, you said before.
Yeah, roughly. In
It
the
depends
daytime.
on the number of programs, the number of frequencies you need to treat. Yeah. So normally probably one frequency 5 minutes or separate.
Most of the time it's 5 minutes. But for example, I treat myself every night with the custom care and the magnetic converter. I use these two devices together at night. And that program, I run what we call the concussion protocol for the brain, the vagus nerve, my small intestine, my liver support, my brain, and and that program runs 3.5 hours. I have another program for neck pain. I'm 78, so it's, I have a neck that has a fair amount of trauma. I ride horses, climb mountains, ski. And so I have days when my neck really bothers me. I have a protocol for neck pain. And I put the two magnetic heads, one on either side of my neck. That program runs 1.5 hours. And I punch a button, go to sleep, wake up in the morning with no pain. I have a protocol for skin anti-aging, and I put adhesive electrodes here and here, and I sleep on my back because I have a CPAP, and I punch the button on the custom care. That protocol, I've made it longer because I don't like doing it very often, and it runs maybe 1.5 hours to 2 hours. And I run it twice during the night. And the results show up not the next day, but the day after. And all of this looseness goes away. The labial folds go away. No wrinkles here. I have no wrinkles here. I don't use Botox. It's all FSM. And I have to use it only occasionally because otherwise it looks kind of creepy to be almost 80 and look like you're 50, right? So just the anti-aging is one way. Women will spend $2,500 for a device that does anti-aging without blinking, but $2,500 for something that treats neck pain? No. Talk to me about wrinkles.
Yeah. Carolin, this interview will take me a while to think about.
It's Uli, until you feel it with your fingers, when you run a frequency. So there's a slide here that says, let's see.
You need to share again because I shared. So, yeah.
Okay. It's the other one. Come on, where is it? There it is. So there's a slide here that says notice. Where is it? There it is. So what you feel, can you see that?
Not
Can
yet.
you see the slide?
No.
Oh,
No.
okay. Share. All right. Screen. There it is. Where'd it go? I know. It's like, where is it?
On the top right, there should be share.
Share.
And then you select the screen.
This one. There it is. Right. So
yeah, it works. Yeah. Super.
So when we this one, when you run the frequency inflammation in, this is the medulla or the accessory nerve, the only thing that happens is the upper trapezius melts. When you run the frequency torn and broken in the ligaments, the lateral suboccipitals melt. When you put your finger on the RCP minor, it is hard and it softens only when you run 13 and 443. So that's what the practicum does. Honestly, until you feel it with fingers. So the course involves the lecture portion, but the practicum the lecture portion makes it make sense to your brain because it's very rational. But your fingers tell your brain that it actually is true because you have your fingers here, the frequency runs, and only this happens. It's quite extraordinary. Yeah.
Nice. Yeah. I think we've touched everything on my list.
Good.
Did we leave something open from your side?
No, my side is only whatever you're interested in.
Yeah.
It's good.
No, really. It's really a very interesting topic because it's a new approach. And when you said before that it took 3 to 6 months to get the ligaments or the structures stable, the muscles stable, and the shift to 1 millimeter, it's very fast.
Oh, really?
In my world, like what I was telling on my channel all the time is like, you need to improve from year to year. Your target should be to be a little bit better next year. So I'm also fighting now for 4 years. Yeah. And if you've watched me a little bit, I do very crazy things. But I do improvements from year to year, and so I feel I'm on the right path. But if you can fix it or you have cases with 6 months, this is phenomenal.
I had no idea. I don't know how other people treat it.
Yeah.
So I don't know. I know that injecting it is very dangerous. And then the surgery here in Portland, you can't find a surgeon.
Yeah, there is one surgeon in Europe, or maybe two. You need to pay by yourself. In Barcelona, you pay 70,000 euro. So people try to get donation because it's not covered by the injury. Here in the German language area, CCI is not acknowledged by insurances. So people need to pay everything by themselves. And as the disease is not known at all, it's always psychological, like you have
it's all in your head. Yeah, right. And it's like, what's really odd is that when you do an open mouth side bending x-ray, you can see it. I mean,
it's not possible in Europe. There is no machine. There's no digital motion x-ray in Europe.
No, it's not digital. No, the motion x-rays are horrible. They show too much. It's this is a standard medical.
Oh yeah, okay. The normal
mouth.
Yeah.
And then you tilt your head, and I tell my patients,
this is available. Yeah.
Hold on to something and take pain medication because it's going to hurt.
Yeah.
Right. And try not to pass out. So you tip your head and it slides, and you tip your head and it slides. And you have the radiologist document how many millimeters. The other thing is that the patients, I've seen 2 patients that have had the CCI surgery, and both of them had such terrible nerve pain and scar tissue from damage to the occipital nerves. The surgery is very dangerous. And but I'm prejudiced because I only see the failures. Yeah, it must be successful for someone, or they wouldn't do it.
Yeah, I mean, there are people that cannot stand up again, that just
My.
lying for years, and then of course you would probably do the surgery because, I mean, I would try everything, but if nothing fits, then you would need to try it. Yeah. Anyway, Carolin,
How
thank you
nice
very
to
much
talk
for
to
this
you.
very interesting conversation. I hope it was also very fruitful for you. Yeah, if you have comments, please comment below this video. If you have experience with the method, also comment below this video. I hope that we have given you another opportunity for healing or improvement, at least, for cranio cervical instability. So there are many approaches. There is a chance to improve.
Yes.
Yeah, of course, you need to have some kind of money, which is also sometimes difficult for the people because they cannot work anymore. But there is hope, and it's not hopeless. Yeah, and this is a new approach. I need really to think about it. I will also do a translation, a German translation for this video, and bring also the English version. But yeah, I hope that I also address some patients in the United States, or we address some patients in the US, and bring them on the path for the frequencies, because everything is frequency. The universe, everything is frequency. Every cell is frequency. And this is a factor which is not really honored in the Western medicine.
Yeah, it's not well known. We
Yeah.
have nothing published in CCI, and we have a sign in my clinic here in Vancouver, Washington, that says there is hope here. There's never any guarantees, but there is hope, and it takes work and patience, and I hope that your listeners and you now have an acknowledgement that there is some hope.
Yes.
I'm excited. Thank you so much for asking me.
Thank you so much for your time. I mean, we spent a couple of minutes now.
Yes.
But I mean, that's my way. I do not limit a video to 30 minutes, because if you are interested, you listen.
Yes. Well done. Thank you so much.